This is the busiest time of the year, certainly when it comes to things like shopping, flying at the airports, even driving in certain areas. But for respiratory illnesses, it is also a very busy time of year. The flu, common cold, COVID, RSV, all circulating at increasing rates across Canada right now, according to experts. In Alberta, the number of sick kids is pushing some Calgary hospitals over capacity. Alberta Children's Hospital has added 37 extra beds, trying to deal with a surge of kids falling ill. Health officials say RSV is the main driver of the wave. Joining us now is Canada Tonight medical contributor Dr. Samir Gupta to talk about how we can stay safe and healthy this holiday season. Dr. Gupta, thank you so much for joining us today. So as we heard in the run-up there, some hospitals in this country are over capacity right now. What is driving this increase in respiratory illness?
This is that time of year, Mark, and we kind of talk about it every year, and for a few reasons. One is just viral factors. Some viruses have an easier time surviving in the drier and colder air, whether it's in the air or on inanimate surfaces, so viruses themselves do better, but largely it has to do with our behavior. It's cold outside, it's snowy, so we tend to be more indoors. Indoors, viruses accumulate as opposed to outdoors where they disperse, so they have an easier time spreading indoors. And then it's that time of year where we're getting together with friends and family. And when you have big get-togethers, you have more people in that same space. And so more opportunities for that virus to be present and then to spread in that environment. So quite predictable. We see it every year and we kind of talk about it every year at this time.
Yeah, I don't think it's a surprise necessarily that, these illnesses are going around this time of year. It's just the sheer number in which they are. Speaking of which, what precautions can people take to minimize risk to especially vulnerable friends and family?
Yeah, and that's key. That we worry most about the vulnerable among us. There are a number of things people can do to prevent from getting the virus at all. So we talked about the fact that having a lot of people in the same place at the same time, particularly if it's not ventilated, that's a high-risk environment. So avoid that environment if you can. If you're going to enter that environment, try to improve ventilation in your get-togethers, try to open windows, open doors. The other thing, of course, is masking. Masking is still something very easy to do. It protects you, but it also protects others around you in case you are pre-symptomatic or asymptomatic.
That was Canada Tonight medical contributor Dr. Samir Gupta. He joined us from Toronto.